members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, let me once again apologize for the late start of this briefing. We had so much to cover after a very elaborate review during the weekend. However, I welcome you all to the national briefing by the Presidential Task Force, PTF, on COVID-19 for Monday, 13th July 2020. For 2 days last week, the Presidential Task Force conducted a mid-term review of the national response strategy. The objectives of that review were: 1, to review the Presidential Task Force achievements, challenges, and opportunities for improvement of the COVID-19 response efforts from its inception to June 30th, 2020. And 2, engage key stakeholders in developing the way forward on the overall COVID-19 response efforts. The midterm review had in attendance legislators, including the chairman of the relevant committees on health in the Senate and the House of Representatives, the Office of the Vice President, ministers, diplomatic community, as well as development partners. At the end of the 2-day meeting, key resolutions covered the following areas and actions we intend to take. 1, case management deficit. The course of action here is focused on having enough oxygen nationwide as the number of hospitalized persons increases. At the outset of this pandemic, we thought that ventilators were the things that were needed. But as we progress in case management, we realized that we need more of oxygen condensers to be provided in hospital environment. 2, testing deficit. The course of action is to establish 1 sample collection center per local government area. 3, strategy for high burden areas. The course of action here is focused on high burden local governments with precision interventions, including risk communication. 4, risk communication itself would increase community engagement, including engagement with religious and traditional rulers. 5, state ownership and collaboration. Here we would increase state ownership by increasing state engagement and collaboration, and also strengthen ownership at the state and local government levels now that we are at the stage of community transmission. 6, compliance on IPC measures. The course of action here is that we will institutionalize IPC policies in healthcare facilities and take steps to increase compliance of non-pharmaceutical measures, especially the use of masks in public places, hand washing and the use of hand sanitizers, and the observance of physical or social distancing. 7, private sector. We will continue to increase engagement with the private sector. 8, industrial development as a gain from the pandemic. In spite of the losses as a result of the pandemic, we believe that we need to support local production of PPEs and other critical supplies in the country. 9, movement post easing of lockdowns. Here, the course of action is communicating that anyone above 60 years or persons with morbidities such as hypertension, diabetes, autoimmune disorders, cancers, etc., should stay at home and avoid social events as they are at highest risk of infection and mortality. 10, government meetings and board meetings, as much as possible, should be conducted virtually until further notice, and all unnecessary travels for meetings by government officials should be suspended. 11, post-PTF national response. The course of action here is to develop an exit strategy beyond the life of the PTF, that is beyond September 2020. Underlying the above as a cross-cutting initiative is an enhanced risk communication strategy designed not only to educate the citizenry on the virulence of the virus and the individual and collective roles, that more importantly, to tackle the deliberate misinformation being bandied around, especially in the social media. An enhanced risk communication strategy becomes inevitable when we realize that within the last 24 hours, the world witnessed the largest single-day cases of 230,370, while in Nigeria, the last week recorded the highest weekly fatality of 70 deaths. The rising fatalities in Nigeria is not unconnected with denial and delay in seeking help. You can see, in spite of the trillions of dollars that is invested worldwide, we recorded in a single day the highest number of cases since the outbreak of COVID-19. I will want to support the foregoing position with an insightful quote from Dr. Michael Ryan, the WHO Executive Director of Health Emergencies Program, on the rhetorics of denial and the need to take responsibility. See the projections if you have put it on, where he said, I quote, "Every person needs to look at his own risk. You need to be aware of what is the local transmission. You need to know what the transmission in my area is. We do this every day in our lives as human beings." Can you increase the projection, please? We manage risk. We decide when we cross the road. We decide when we fly. Oftentimes when you wake up in the morning and you want to fly and you see that there is some bit of cloud and thundering, oftentimes you will not go to the airport. You will decide to shift your trip. We decide when we have an operation or not to have an operation. What we need is information to make those risk-based decisions. We need to gain the knowledge to be able to make good decisions. We decide on our proximity to other individuals. We decide on the intensity of our social engagement. We decide on how long we spend in that environment. We can be advised by government for all it takes. We can be advised by science, but in the end, it comes down to personal motivation and personal choice. But in the end, it comes down to individuals and it comes down to communities. If it does not feel safe, it is not safe for you. End of quote. The Presidential Task Force is also encouraged by the compliance messages that have gone viral on the social media. One of those that caught my attention gives 3 major reasons why COVID-19 is spreading fast, and it reads thus. A, they are my colleagues, so I can speak without a mask. I had that encounter yesterday with a friend who came to see me. That's B now. They are my close friends, so I can speak without a mask. I politely had to remind a friend who came to see me in the office yesterday, when he lowered his mask and I had my mask and my shield on, that he should put back his mask on top of his nose if he wanted to remain in my office and speak to me. C, they are my relations, so I can speak without a mask. These 3 situations presupposes that you are lowering your guard or ignoring basic danger. This message is so poignant that if we juxtapose it with the fact that crowded places and closed spaces create environment for the spread, we should behave more responsibly. I want to thank the author of the above and other related messages that I see on social media. As we progress in this phase and acknowledging that testing capacity has to be increased, we encourage as many Nigerians as possible to get tested. We have expanded the network of sample collection centers. In Abuja, a sample collection center has been set up at this day dawn, and all government hospitals in the FCT have been designated as sample collection centers. The Honorable Minister of Health will provide details in due course. Getting tested is the only sure way of making sure we know the prevalence of the virus and understand how to tackle it effectively. The visit of some media houses over the weekend to a Sokoro Observation Center and their interaction with some patients should give Nigerians the comfort to get tested and treated if necessary. As often repeated by the Presidential Task Force, contracting COVID-19 is not a death sentence, but not presenting yourself for testing or treatment when symptoms become observable could likely lead to avoidable death. Ladies and gentlemen, as you are aware, the domestic flights in the aviation sector have resumed. As at the last count, 6 of our airports, Lagos, Abuja, Kano, Owerri, Maiduguri, and Port Harcourt, have commenced operations. We wish to commend the aviation players for the measures put in place and hope that this would be sustained until we overcome the pandemic. The PTF has followed with keen interest the conversation around the resumption of schools. We recognize that our children are precious and we would not do anything to compromise their safety. The Presidential Task Force has assessed the circumstances and has put in place necessary guidelines to be followed, while the managers of the sector have the responsibility of drawing up the protocols and determining the dates. We urge Nigerians to follow closely the critical steps being taken by the Federal Ministry of Education in conjunction with other stakeholders. Further to this, the Federal Ministry of Education has released guidelines for schools and learning facilities reopening after COVID-19 pandemic closure. The guidelines clearly spell out major things to consider before schools and learning facilities shall reopen. The reopening process, sequencing, and scheduling of safe reopening, and decisions about schools reopening. The Minister of State for Education will elaborate on this. The Presidential Task Force recognizes the efforts of our innovators, researchers, and research institutions in working to get a solution to COVID-19, especially its cure. However, we refrain from misleading the public into believing that a cure has been found or certified when indeed the validation processes is still ongoing. This call is necessitated by the recent publication that a cure for COVID-19 had been listed by NAFDAC. The agency has debunked the claim, and we advise Nigerians to be vigilant. In furtherance of the partnership we have built, Nigeria received $8 million worth of PPEs from the government of Germany and the ECOWAS Commission over the weekend. Also in line with Mr. President's role of the ECOWAS COVID-19 champion, Nigeria provided the warehouse space and shall support with the logistics of delivering the materials to other ECOWAS member countries. The Presidential Task Force would like to use this opportunity to thank the government and the people of the Federal Republic of Germany and the Economic Commission of West African States. I must not close without reiterating the need for all of us to remain conscious of the fight before us. The pandemic would not go away by wishing, neither would it go away if we refuse to keep safe. Please, let's all resolve to play our part. While government does its best to save lives and livelihood, to this end, the PTF wishes to reiterate the following. All government offices shall continue to hold virtual meetings in their offices, especially where participants exceed 4 persons, and they should also suspend unnecessary travels for meetings. 2, for corporate organizations, board meetings, etc., the reopening of the domestic flights should not be misconstrued. The PTF strongly encourages virtual meetings as well. 3, we still urge places of worship to cautiously follow the guidelines on public gatherings. And 4, would urge members of the political class, particularly in states where elections are scheduled in the months of September and October, to exercise utmost circumspection in their gatherings for whatever reasons. I now invite the Honorable Minister of Health, as well as the Director General, Nigerian Center for Disease Control, and the National Coordinator, to give you updates after the Honorable Minister of Health, and thereafter other ministers.
COVID-19 response and Secretary to the Government of the Federation, Honorable Ministers here present, Permanent Secretaries, National Coordinator, Director General, Directors, ladies and gentlemen. The Nigeria Center for Disease Control has now carried out a total of 183,294 COVID-19 tests in Nigeria, 28,296 of them within the week since my last briefing. 32,558 persons in total have been confirmed positive. The high figures within the past week compared to the previous weeks suggest an increase in the pace of testing, but also in infection incidents. From reports of the activation of sample collection sites in the FCT, the laboratory throughput will increase, as will the number of positives, until the curve begins to flatten at a yet unknown time. This strategy of creating more sample collection sites will follow a protocol of training, equipment, designation of correct space, according to a protocol to be set up by NCDC and will be replicated in other states of the Federation. Therefore, increasing bed space at state level will continue to be advocated, as will the training, recruitment and training of health personnel to man the treatment and observation centers. We all know about the addition of the community support centers proposed by the National Primary Healthcare Development Agency to increase the space required for observation, particularly, and for treatment of mild cases. However, the expected increase in positives would not be so dramatic if there were better and improved adherence by citizens to all advisories, and if we all determine to take ownership of and responsibility for reducing the spread of this disease. I emphasize again that conscientious wearing of masks is continuously being confirmed in various studies as the easiest, cheapest, and most reliable way to check the rate of spread. Some countries have made it mandatory by law and imposed a fine for non-compliance. Regular washing of hands, avoiding crowds, social distancing, and use of minimum of 65% alcohol-based sanitizers remain as relevant as at the beginning. 13,447 COVID-19 cases have so far been treated and successfully discharged in Nigeria, and we have regrettably recorded 740 fatalities on the whole. Our aim is to further reduce the fatalities by ensuring that those defined as vulnerable are protected with messaging of non-pharmaceutical measures and prioritized for admission to observation and treatment centers, even if they do not yet have symptoms, but so long as they are tested positive. On Saturday, the Federal Ministry of Health joined others from the PTF at the Premier Medical Warehouse in Jabi, at the invitation of the Director General of the West African Health Organization, WAHO, the President of the ECOWAS Commission, and the German government, to receive a donation of medical equipment and supplies to the government and people of Nigeria, courtesy of WAHO, the West African Health Organization, to support our effort in responding to the COVID-19 pandemic. The donations include ventilators, test kits, personal protective equipment, and face masks, all being critical items in our COVID-19 response strategy. I wish to here once again thank WAHO and the ECOWAS government and the German government for the kind donation and also for facilitating the delivery. The 17-man team of the Federal Ministry of Health that was deployed to Calabar to engage with the Cross River State government in setting up their COVID-19 response and aligning it with the national response strategy has returned to Abuja after a successful mission led by the Executive Director of the National Primary Healthcare Development Agency. The team comprised of staff of Departments of Family Health, Port Health Services, Public Health, Food and Drug Services, National Primary Healthcare Development Agency, Nigeria Center for Disease Control, National Agency for Food and Drug Administration and Control, and representatives of the Standards Organization of Nigeria and the Nigeria Immigration Service. You will see that this is a very comprehensive list, and they had useful interaction with the Cross River State government and ministries, and were able to address all areas of concern and of interest to the federal government and also Cross River State government. As we all know, Cross River State government has been concerned about its border with Cameroon and also about its coastal area and the traffic that goes on in there, for which reason Port Health Services and Immigration were with the team. Standards Organization was also there to review products manufactured within the state for possible validation. The Federal Ministry of Health will encourage and prioritize patronage of locally made commodities which meet a minimum specification. With this successful constructive engagement, I am pleased to report that Cross River State is now aligned with the Federal Ministry of Health COVID-19 response and has started reporting on the national dashboard. We have activated the Gene Expert Machine at the University of Calabar Teaching Hospital to increase testing capacity in the state, and NCDC has resumed deployment of rapid response teams to provide technical assistance to their public health EOC to strengthen their incident management system. Following the intervention of this ministerial team with the Cross River State branch of the Nigeria Medical Association officials, issues that led to their withdrawal of medical services by doctors in the state were resolved, and the strike action has been called off. We plan to replicate the success in Cross River State with other states of the country where the need for policy alignment is found to be wanting. News of the development of an RNA extraction kit and its validation has been relayed to me from our research centers. I'm very proud of this development, which I have asked NCDC to evaluate, because it will be a further step in reducing the dependence on imported commodities. I hope our researchers will continue with this trend and can be assured of the report of the Federal Ministry of Health. The National Institute for Pharmaceutical Research and Development has also applied for financial support to continue its research on the efficacy of Artemisia annua combination in the treatment of COVID-19, which I hope will resonate with research sponsors. NAFDAC recently also gave a report on a traditional herbal medicine that it looked into, which provide information on safety for use. But that report does not cover efficacy. The difference must be made very clear. The This Day Dome Treatment Center has joined the list of testing centers and will soon be open for treatment as soon as hospitality services are secured. The renovation of the Agura Hotel will begin very soon as an additional observation center for level 1 and selected level 2 cases. This will increase FCT capacity for bed spaces considerably. I thank you all for your attention.
Of the Presidential Task Force, Honorable Ministers of Health, Honorable Ministers, gentlemen of the press. Thank you again for joining us this afternoon. Today's comments will be fairly brief from my side. Basically to comment on some new evidence coming out of the global community that is affecting some of our work and response strategies. As I've often said, we're learning new things every day as we respond. This is a new virus, so every time we speak about how we are responding, we always speak with humility in the understanding that our knowledge about this virus is evolving. So there's no shame in saying, I don't know, or we're learning, or we will get back to you, or that evidence is evolving. And that's the spirit in which we have started the response and which we will continue. Understanding the modes of transmission of any new virus is very critical for defining response strategies. For COVID-19, from the very beginning, our understanding based on other coronaviruses that spread was primarily through droplets. Droplets are excretions from the respiratory tract that can't stay on in air. They obviously ultimately fall to the ground after a few minutes. However, as we have studied transmission, studied clusters of these infections, we saw increasing evidence from clusters of infections where droplet transmission did not seem to be enough to explain the clusters that we are seeing. Diseases that are commonly understood to be spread by what we call airborne infection are things like measles, influenza, that can be suspended in the air and transmit over longer distances. Over the past few weeks, increasing evidence has emerged that in addition to droplet infection, we cannot rule out that airborne transmission is also possible as a mode of transmission of COVID-19. And WHO has released updated its guidelines on this, saying exactly the same thing, that we cannot rule out airborne transmission, and therefore we have to act in a precautionary way, assuming that this is also possible given the new evidence that is emerging. Why is this important? It means that staying together in closed spaces, in clusters, such as in restaurants or in small rooms without very poor ventilation, increases the risk of transmission. Indoor activities are riskier than outdoor activities, especially when there are many people in a room, when we don't adhere to distancing, and when we don't wear masks. So what does this mean for our response? It means that we have to speak even with a louder voice on the things that we have been saying already. That we have to even strengthen further the avoidance of mass gatherings or gatherings of any nature in small spaces. So when we talk about mass gatherings, we often think about football stadia. But once you exceed a normal level of what is possible in a room, especially in a room with poor ventilation, then you're already too many people in that room. So we have to pay attention to ventilation, pay attention to distancing, stay outside as preferred to inside, continue to wash our hands, and absolutely wear a mask whenever we're outside the home. So this is new evidence that has emerged We will keep adapting our guidelines as we progress. That is what happens when there's a new infection and we keep learning. It's not shameful to change your guidelines from week to week as new evidence emerges. That is what we are committed to doing, to guide the response by our leaders, to give them the best evidence possible to make the very hard decisions they need to make. We need to make collectively as we learn to live with this outbreak as safely as possible over the months to come. Thank you.
Gentlemen of the press, good evening. As mentioned by the chairman, we had a 2-day retreat last week. It's one of the reasons why we didn't have a media briefing on Thursday. And this gave us the opportunity to reflect on what we have done over the last 3 months, look at the opportunities that we may have missed, and also think about what needs to be done over the next 3 months of the PTF. We have interfaced with our partners as well as the public, and we have listened to your comments. Moving forward, we will ensure reinforcement of non-pharmaceutical interventions because it's very clear there's been a progressive and gradual drift in compliance. We will increase our public awareness and campaigns because there is no vaccine for COVID, there's no preventive therapy. The only thing that will get us out of this pandemic is by changing our behavior. We will also improve our engagement with states. We know from the experience of other countries that political commitment at the highest level is essential if the COVID response is going to be successful. Mixed messages or body language that suggests that COVID is not a problem ends up being replicated at the population level and results in increased transmission. We'll also improve our coordination with the private sector and increase testing, which continues to be low compared to where we need to be. In view of this, we have also looked at our implementation guidelines, and I think it is the right time to reiterate the current guidelines that we have on the eased lockdown, since it's been about 10 days since we started the phase 2 extension of the eased lockdown. As you are aware, the eased lockdown was primarily to sustain the gains of the earlier phase of the response while allowing additional sectors of the economy to operate. We did this in order to achieve the desired balance between saving lives and ensuring that the well-being and livelihood of our citizens are protected. Therefore, I would like to reiterate the guidelines which started on the 1st of July. In terms of curfew, we continue to maintain a nationwide curfew from 10 p.m. to 4 a.m. For transportation and travel, both interstate and intrastate, movement across state borders is allowed, but only according to curfew times. Vehicles should preferably be for short distance trips. The windows should be preferably open. Observation of non-pharmaceutical interventions is critical, and in this regard, the PTF is strongly recommending that those above the age of 60 years stay at home, and not only stay at home, but avoid interacting with other members of the public outside their immediate bubble. The aviation industry has resumed limited domestic flights with the provision of sanitizers and appropriate PPEs. They also have designated areas and procedures to isolate passengers with suspected COVID-19 infection, ensure crowd control, and queuing discipline so that we have social distance maintained, as well as providing additional training for COVID-19 staff and all other non-pharmaceutical interventions. We are pleased with the measures put thus far by the Ministry of Aviation,
in this
and
order.
we will continue to
Honorable
work
Minister, Environment,
with aviation as well as the general public to ensure that this does not pose a risk when it comes to increased transmission of COVID. Linked to this is the need to make sure that people wear face masks in public. And again, we would like to emphasize the principle of no mask, no entry, no mask, no services should be provided in public spaces, including government offices, as well as the private sector. In terms of working hours, we continue to maintain normal working hours based on curfew arrangements apart from government offices, recommending a 75% capacity while adhering to other non-pharmaceutical interventions. Only essential staff of grade level 14 and above are to work in government offices from 9 a.m. to 2 p.m. Mondays to Fridays. Physical meetings from the government side are strongly discouraged. Only virtual meetings should preferably be held until the end of the pandemic. We are also recommending to the private sector to continue to maintain virtual meetings. By opening our airspaces, we are not saying that people should start roaming all over the country for meetings that can be held virtually. It is still safer for you to keep in one place rather than moving around. Markets, the opening of shops should be based on arrangement by local authorities while observing all mandatory non-pharmaceutical interventions. We call on the security services to ensure that those places that we have advised to remain closed, including bars, gyms, cinemas, event centers, and nightclubs. In terms of additional information, the public are advised to visit our website and social media platforms for complete guidelines and other information. This is the https://statehouse.gov.ng/COVID-19, or the social media platforms at DIGI COMS, COMMSNG. We appeal to Nigerians to continue to comply with our guidelines, to please remain vigilant and not allow fatigue to set in. Let us continue to protect ourselves, our loved ones, and our community from COVID-19. Let us stay safe and stay alive. Thank you.
Good evening. This is from the Federal Minister of Environment. A simple reiteration of some of the new things that were just announced by the National Coordinator, the Chairman, and NCDC. Jama'a assalamu alaikum. Muna ci gaba da ƙara yin bayani ne akan ita wannan cutar corona, wannan annoban da ta bullo kusan ƙarshen wancan shekarar da ta wuce. Kuma muna ƙara sanar da mutane ne cewa har yanzu cutar nan tana nan, ba da bayan tana nan tana ci gaba da haɓaka ne, domin idan mun duba a kulliyomin za mu ji yawan waɗanda suke kamuwa a adadinsu yana ƙara yawa ne. A da za mu ji 200, 300, 4, yanzu kulliyomin muna jin 500 ne zuwa sama 700 da wani abu. Ba kuma a ƙasanmu kawai ba, a ƙasashen duniya akwai wuraren da har yanzu tana ci gaba. Jama'a a ɗauki wannan abin da gaske. Kuma har yanzu da waɗanda suke tunanin a'a ba ta akwai, tana kama kowa, ta kama jariri, ta kama ma ɗan shekara 90. Saboda haka tana kama kowa. Akwai abubuwa da ya kamata mu yi don mu kiyaye kanmu. Akwai kuma waɗanda ma sun fi kasancewa cikin haɗari na wajen kamuwa da wannan cuta. Misali, muna iya fara da dattawa. Duk wanda yake ya kai shekara 60 misali, yana cikin haɗari fiye da wanda shekarun shi bai kai haka ba. Saboda menene? So tari irin haka zaka ga garkuwan jikin mutane sun ta ɗan ragu kaɗan. to wanda yake shekara 60 zuwa sama in ma baka da abin yi a waje ko shiga cikin mutane ko na makamancin haka, kai zamanka a gida, wannan shine zai fi maka alheri. Waɗanda kuma suke da cututtuka, waɗansu cututtuka da suke rage garkuwan jiki, kamar misali ko masu ciwon daji wato kansa kenan, ko masu ciwon siga, ko masu ciwon hanta ko koda, duk irin waɗannan su tabbatar suna kare kansu. Kuma har a yanzu fa babu tabbataccen magani na wannan cutar, saboda haka abinda dai mutum zai ci gaba da yi shine bin waɗannan ƙa'idojin da aka gindaya. Na ɗaya dai sa wannan takunkumin yana kare mutum ƙwarai da gaske. Ƙasashen duniya a kulliyomin suna ƙara bincike, kuma binciken yana ƙara nuna cewa wannan takunkumi yana kare ka. Idan ka sa, ka yi kanka sauki. In baka sa ba ko ka ƙara sa kanka a cikin haɗari na kamuwa da wannan cuta. Kuma an ƙara gano cewa ma da ana tunanin in ka yi tari ko atishawa ko ihu, irin feshin da zai fito ana tunanin ai kamar ɗigo ne na miyau da zai faɗi ƙasa shikenan. To yanzu kuma an gano cewa yana iya kasancewa ya zauna a cikin iskan da ake shaƙa na wani tsawon lokaci. To kaga idan baka sa wannan takunkumin ba, kana cikin haɗarin yiwuwan iya ka shaƙi wannan abu. Saboda haka yana da matuƙar muhimmanci. Na biyu, wanke hannu akai-akai ɗin nan. In ka taɓa wancan ka taɓa wannan, ka wanke hannunka kafin ka taɓa fuskanka. Saboda dai har ila yau bata dai canza zani ba, yanda take kama mutane baya har yau haka take kamawa, ko dai ta shiga ta baki ko ta hanci ko ta ido. To ka tabbatar ka wanke hannunka yanda ya kamata. Kuma shi takunkumin mana tana in ka sa, waɗansu sai kaga kuma an sa takunkumi sai kuma a fito da hanci zai keke a waje ajiye shi. To kana zuƙan komai da komai da yake wucewa ta gabanka, saboda haka dole ka sa takunkumin nan ka rufe bakinka da hancinka gaba ɗaya. Har ila yau tazara, ba da tazara wajen mu'amala, yanda ko da mutum ma ya atishawa ko tari ɗin ba zai yi saurin isa inda kake ba. Ko kana da takunkumin ka ba da tazara. Har ila yau ka guji inda ake da taron mutane da yawa. In ba dole ba fa kar ma ka shiga taron jama'a. Wuraren da ya kamata ka ƙara kiyaye kanka shine kaman kasuwanni, tashan jirgi, tashan mota, filin jirgin sama, da wurare inda mutane sukan taru da yawan gaske. Saboda haka ya kamata mu san cewa corona ɗin nan tana nan fa daga nan har zuwa wani tsawon lokaci. Gara ma mu saba da rayuwa da ita daga nan har zuwa wani lokaci, domin ainihin duk ƙasashe inda ake bincike ana ganin cewa ne har ƙarshen shekarar nan wannan matsalan tana nan. Akwai wuraren da ma ana tunanin har yanzu ba su kai ƙololuwan inda ake tunanin za su kai ba. Misali, ko mu nan ai gashi ƙaruwa take yi maimakon ta ragu. To in ko tana ƙaruwa kullum, to kai kasancewa akwai wani abu a ƙasa. To kuma da abin da ya kamata mu yi shine mu kula da wannan, mu san yadda za mu yi don mu ci gaba da kare kanmu. Dattawa idan mun fita, musamman ku matasa ma tukuna, zan so magana da kan matasa, da za a fita a je a dangulo wancan, a damuko wannan, a cafo wannan, ka kuma kama hanya ka dawo cikin gida a je wajen iyaye ko wajen waɗansu, akwai matsala. In kana da dattawa, wallahi a guje su don kada a sa musu, ai nesa da su, a kuma sa takunkumi, domin su ne suke cikin haɗari fiye da kowa. Saboda haka an ce idan kunne ya ji dai gangan jiki ya tsira. In baka yi dan kai ba, to ka yi dan waɗansu. In kai kana tunanin baka yadda ba, ka yi dan waɗansu don ka kare waɗansu. Wannan shine bayani. Salamu alaikum.
Dear, good afternoon, and thank you very much indeed for all the support coming through this midterm. You were with us when we went for the trial or the dry run for Lagos. We did Abuja and Lagos, and we did the one for Kano as well on Saturday. It all went very well. We were very happy with all the efforts put together by the aviation community, especially FAN, NCA, and our other agencies. We're very glad that all airports in Nigeria currently are compliant with the protocols, so they are safe to operate in and out. We have decided to stagger, if I use the word correctly, the entry and exit of the airlines into particular airports, so we don't populate the arrival halls and departure halls. And this is extremely necessary so that we reduce the number of people and we can create the necessary social or physical distancing that is required. So we're happy, we're good, everything is good, and carve okay, as they say in civil aviation. Then I've been asked to re-echo what I said here before regarding the seating arrangement inside aircraft cabin. We did explain here, and it's based on science, and science is factual and real, that the way airplanes are made, the air that we breathe within the cabin of the aircraft, like I said earlier, is ambient air, which is naturally clean at altitudes. And even during taxi on ground, the one that is contaminated is the one that is ducted and compressed. And during the compression process, the temperature will rise up to 200 degrees centigrade, which is twice boiling water. Then it gets cooled to about 2 degrees, and then it is now passed through a high efficiency filter. And that high efficiency filter has the filtration efficiency of between any range between 0.1, 0.3 microns. So it's able to take out all organisms, including bacteria and viruses. And then this process gets recycled, gets circulated once every 2 minutes. So on your flight to Lagos, it's likely that it will happen between 25 and 30 times before you land. So it's being filtered. And then, of course, also, we all sit facing forward, facing the cockpit, and the flow doesn't come from the cockpit backwards. It comes from the ceiling downwards. So all of these studies have been conducted from the beginning of this COVID last year till now, and it's been found and proven that the chances are extremely reduced and we're very safe to sit next to each other, provided that on our part, we clean the aircraft inside by decontaminating the aircraft, cleaning the surfaces. Every passenger is wearing masks. No passenger is showing any sign of COVID-19 at the point of entry into the airport and also at the point of boarding the aircraft. And then while you are within the halls, you are keeping physically distant with each other. Once these protocols are observed and you are in the cabin of the aircraft that is decontaminated before you enter, we are safe and we're good to travel in that manner. So therefore, it is safe to be in those cabins. I was asked to re-echo. Then also as to the question of international travel, when are we beginning international travel? Certainly, you are very aware that there's so many countries that had placed ban on countries that we cannot go even from Nigeria. And also Nigeria, of course, will place ban on other countries that cannot come in here because everybody is trying to keep safe. These and many other reasons will make us to be cautious, to study some more, and to liaise with all of the stakeholders and then decide when we will open these international flights. In aviation, we personally want to open yesterday because we are losing revenue, we are losing money, we are bleeding, but we must remain alive first before we are able to make money. So we have to be responsible enough to ensure that everybody is safe and whatever decision that we've taken is taken in the interest of humanity in general. So this is the guiding principle, and we'll continue to observe the developments internationally. We also have an economic community within which we live, which is ECOWAS. We also liaise with them and then to see what is good for us as a country to open, and we reduce the risk of contaminating our people. Then lastly, our attention in aviation has been drawn by to a write-up by one certain Professor Aminu Bayawa, I guess that's the name, but maybe Aminu Bayawa, or I don't know really what the real name is, to the fact that on Saturday, I ordered in Kano, I ordered a flight, Max Air flight, to delay and pick up members of task force, and they were at the airport at 10 a.m., and that I ordered the plane to wait there until 4:30 for departure. This is far from the truth. Professor should please kindly dig out and find out. We were supposed to be on a dry run. We had a chartered flight of Azman that would have departed at 12:30. I personally got to the airport in Abuja shortly before the flight and wanted to go through the baggage to see how the baggage is being conducted. Eventually ended in the flight, and that flight left about 1 o'clock, which was meant for 12:30. And we arrived Kano, and we didn't go for any wedding in Kano. We went straight to see the arrival hall. You were all there, the press with us, the media. We went to arrival hall, then we went to inspect the new airport in Kano, which is 99.5% completed. And we're all very happy, after which we prayed and came back to the departure hall, followed through the protocols, and waited in the departure hall for at least 30 minutes. We waited for the flight for at least 30 minutes before the flight departed. Well, for the ones that departed also out of Abuja, it's not our course to delay it till 1 from 12:30. However, I had a course to apologize to some of them who thought it was the minister. I'm not that reckless. I don't think I'm that pompous. So we did that. So therefore, we never delayed any flight. PTF didn't go. The PTF didn't go for any wedding in Kano. Neither did Senator Shekarau and Senator Akabiru Gaya. And all of you that were with us went for any wedding in Kano. I would have loved to go because that's a wedding of the son of my friend. But call to duty didn't allow me to do so. So we were there for about 2 hours, and we left and we waited for the flight for 30 minutes before we depart Kano. However, if anybody feels crossed, it's not because of us, and we apologize for the mix-up. Thank you very much.
A careful and planned reopening whenever it will happen and how the process should begin. It is a 52-page document, and we've circulated it. I'm sure when the chairman permits, the permanent secretary will let you share this document. It's in 10 parts, the introductions, the forward and everything, but at chapter 6, where we deal with the steps that need to be taken for schools and other learning institutions to be safe enough to open. And if they open, what they must do to stay open and how they will proceed with that process. We are willing to share the document. Chairman, right? Yeah. Okay. The chairman says the PTF is now willing to share the documents. They've assessed all of it because in its preparation, the NCDC, the WHO, and everybody has given their guidance. So it will be some sort of document. Like I said, it's a 52-page document, and I will think it may be nice for you to get copies. Then you can help us x-ray it. We need to also appreciate that, like the DG NCDC has just said, this disease or this COVID pandemic is an evolving process. A lot of people do not know everything. In fact, I learned something very profound yesterday from Professor Morris, who is a pharmacologist, and he said, humidity was something that we hadn't even factored into what we were doing. The humidity of our climate alone can be an issue when you're dealing with even a disease. So some of these things, there are so many things that are evolving, and even this guideline is not cast in stone. If these people who know book plenty explain to us who are teachers, we shall come back to teach further. Thank you very much.
Sir, please, I want to find out, are there long-term effects of COVID-19 on patients who have recovered from this virus? Because I've spoken to some of them who have recovered. The stories seem to be the same. Some of them say, even after testing negative, they still have some of the symptoms like coughing, even strange symptoms like peeling of the skin, discharge from the eye. So I just want to find out, even after recovery, is there a possibility that you will still have some of the symptoms? Now, secondly, still staying with you, sir, aside from what we know, what we have been told by WHO and some scientists in other climes, are there indigenous findings we as a country have come up with concerning COVID-19? And thirdly, still staying with you, sir, today mark 10 days since some journalists here were tested for COVID-19 in this facility, and none of them have received messages stipulating whether they are positive or negative. Well, this is a story of so many people out there who have reached out to me saying that they even have the symptoms, they have tested, and they are yet to receive their result. Another leg to that is that some other persons have come up to me to say that, well, the initial case was when you test positive for COVID-19, NCDC call you and they take you in their vehicle to the hospitals. But I spoke with a doctor, he said, subsequently, it's going to be different. When you test positive, well, you're going to find yourself to the hospital yourself. The NCDC is not going to pick you up. So I wanted to just clarify on that. There are also some other persons that have reached out to me. They said they called the lines 2 days, 3 days, and no response from NCDC. So I would like you to clear all of this. And finally, to Mr. Chairman. Mr. Chairman, sir, in your speech today, you mentioned that, well, you were encouraged that meetings should be held virtually, meaning that most Nigerians will be using the internet at this time. So I would like to find out, is the federal government, through the Ministry of Communication, would they try to regulate the cost of the internet so it can be affordable to an average Nigerian? Thank you, sir.
Good afternoon, all. My name is Friday Okiribe. I'm a reporter with Channels TV. Let me start with the turnaround time for testing, and I would like to direct my question to the DG NCDC. That issue around the turnaround time for testing is actually a major concern. Thank God that my colleague from AIT mentioned the instance that happened right here as we speak. Now, we had cases in FCT here, because I know that your earlier explanation had to do with the logistics that has to do with taking the samples from the point where they were collected to the laboratories. But we have cases in Abuja here, where we know we have a test site here. Cases were collected 2 weeks, 3 weeks down the line. There's no results yet. And closely related to that, we also have some states, as we speak, on the weekend, we have Plateau State complaining that they've run out of test kits. What exactly are you doing regarding that? My next question, I would like to direct it to the Minister of Health. Our visit to the isolation and treatment centers on Thursday. Some of the workers there, the doctors precisely, they confided in some of us that went, that they've only received the special allowance, special risk allowance once, only once. This is from Abuja. So what exactly is happening? Who is withholding this special risk allowance for these health workers? Because personally, I feel pained that these doctors, some of them have spent 3 months in those isolation centers. They have not visited their families, and yet their allowances are withheld. Who is responsible? Do you have any mechanism for tracking whether these people are actually getting their allowances? And lastly, it is directed to the Minister of Aviation. When we did the first dry run to Lagos and back to Abuja, there were robots, and we're told that these robots will be deployed when the airports are reopened. Unfortunately, when the airports reopened about a week or some additional days ago, we didn't see any robots. And as we speak, there is no robot. What happened to those robots? Thank you.
Good afternoon, members of the PTF. Good afternoon, members of the PTF. My first question is for the Minister of State for Education. I would like to know the latest on the WAEC exams. Is government considering going ahead with the exams in view of the condemnation that has trailed the decision? Minister of Aviation, I just saw a tweet from you that travelers can now arrive 1.5 hours before departure. We'd like to get explanation for that. And during the dry run, you did say that social distancing will be maintained in the flight. But with the few ones we've seen, the flights are fully full and passengers have been complaining. So you explain that. Thank you very much.
Good evening, the chairman and members of the Presidential Task Force and my colleagues. My first question is for the DG of the NCDC. You know, we are told that the nose and the mouth are entry points for COVID-19, and that's why we need to wear the face mask. Now, based on your latest finding that COVID-19 can be airborne, is it possible for one to be infected through open wounds or injury? And still with the DG of the NCDC, some Nigerians want to know if the NCDC will consider printing COVID-19 test results in hard copy as against verbal pronouncement of status. And lastly, for the SGF or the PTF National Coordinator, Nigerians want to know when will train services resume since the airports and the highways have been opened. Thank you.
Good evening all. Rachel Abuja from the News Agency of Nigeria. My first question is for the Minister of Environment. So what are the possible impact of COVID-19 pandemic on our environment, and what are also the links between airborne pollution and COVID-19? Thank you very much. My last question to the Minister of Health. So, considering the increase of COVID-19, particularly in the rural areas, and is there anything that we are doing on the integration of mental health services at the primary health care centers and the secondary health facilities? If there's any integration of mental health program in the primary and secondary facilities. So my third question is to the DG NCDC. So last week, Nigeria announced the manufacturing of extraction kits for PCR. Also, what difference would this make to the nation testing strategy? And my last question is, how much will the new research on airborne transmission change the existing advisories and guidelines communicated, especially concerning sectors reopening, such as in aviation and others? Many thanks.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka Odi, I report for Arise News. And my first question actually goes to the National Coordinator. Since we announced our first lockdown, of course, we have spoken about it here time and again that sexual and gender-based violence, we've had more cases. And of course, in recent times, there are more reports that sometimes when these things happen, the experts who are supposed to go help some of these women, these things happen during the period of the curfew. There was an incident right here in Abuja just yesterday, and the advocate was actually held by the police and taken to the station. So advocates that really deal with those who have all sorts of sexual as well as gender-based issues, actually pleading if they can be added to the list of essential workers, because they're going out there to help others. So I would like to get that information from you. And my next question actually is for the Minister of Education, that State for Education. Just this morning, there was a report that the federal government has agreed to pay the salaries of private school teachers that have been owed since the lockdown in March. Can we get a confirmation from you concerning that? And my next question actually is for the Minister of Health or the DG of the NCDC. The chairman today in his speech, he's encouraging every Nigerian to go out there and get tested. Are we considering, changing our protocol as it concerns testing so that way any Nigerian who feels the need to get tested can walk into any of these facilities to get tested, really? Because right now, I know that the last time I had asked you this question, you said you have to have someone who has tested positive or has some sort of, symptoms. But people are concerned, and of course, the chairman is saying the only way we can defeat this virus is to test more. Thank you.
We were testing that robots is supposed to, one, run around the airport to decontaminate and disinfect the areas. Two, be able to identify our passengers, facially recognize them, and for those that are not there, for the robot to, are not supposed to be there, for the robot to show, etc., etc. But we're just trying them, those pieces of equipment and pieces of machines, to see their need for being in the airport. So it's work in progress, relax. When we need them, certainly we deploy them. We're also going to deploy very soon K9 dogs and so on and so forth. There are a lot of things that is going to happen with the airports. Then regarding arrival time, sorry, it was the main gist. Somehow I just skipped it, I forgot. Yes, after the dry run, and having been to Lagos, Kano, and sent our people all over the place, we find out that because we are sequencing the flights, they come in an organized, orderly manner, and they depart. We find out that we're able to go through the protocols and meet our flights when we arrive an hour and a half before our domestic flights. What we said earlier was you arrive 3 hours before. We wanted to err on the side of caution. We wanted to make sure that when you come, you do not congregate, create a bad situation for us and further spread this disease. So that was why initially we said 3 hours before the flight. But now we're definitely sure that if you get to the airport an hour and a half before the flight, you have time to park your car, carry your luggage, go get boarded. Especially, we will recommend that you, where possible, you check in online. That checking in online saves you a lot of hassles at the airport. So 1.5 hours is what it is now. Arrive airport 1.5 hours before your domestic flight. And should we commence the international, it will still be 3 hours, because it used to be 3 hours anyway. So we believe that we keep sequencing the flights to come in and depart at an orderly manner in such a way that we don't cause congestion. Thank you very much indeed.
The first is about workers who have not been paid. I think the workers should write straight away to the minister and lay their complaints. There is a department that's supposed to be running that, Department of Hospital Services, and I would like to encourage all health workers, particularly frontline health workers who experience any problems like that, to convey their problems in writing directly to me. Can also write to the Director of Hospital Services so that we look into it. It's easier and better to track it that way than here. And if anybody comes to complain to you, as they did to you Friday, you also encourage them and ask them, have you written to the ministry? So as to get your reply as to what happened. So we shall look into that and then get back to you on it. Now, because as far as I know, the arrangements are supposed, the allowances are supposed to have been running. So if there's any delay, we'll look into it. The integration of care in rural areas, primary health care, secondary health care with COVID, is that what your question? And mental health, yes, in rural areas, yes. Well, the first is to provide the service itself, provide the site. And not all areas of rural areas are already carrying out COVID tests. We are working now to increase the test sites and to also encourage all health facilities to give attention to anybody who comes for treatment, working to make sure that health facilities, designated health facilities, are able to collect samples and tests. And also to make sure that everybody understands that before you treat COVID-19, you must be accredited. It is not something to be treated at primary healthcare level. And it's also not something to be treated at secondary healthcare. Patients who are positive are sent right away by a referral to a treatment center. Now, the primary healthcare and even secondary healthcare can only help to identify cases and send them for testing, and also manage those who have been tested and have been fully tested and certified, and manage the after effects, which somebody was asking about just now. As for the indication for testing, well, again, the first thing is to make it available. We are beginning to make testing available. The unmet needs for testing are also there. It is true that there are people who refuse to be tested, but I think it is probably even more true there are people who are looking to be tested and do not know where or how or what the protocol is or the conditions are. But there was a time we were extremely careful about our testing because we have very, very few reagents, and now that we're a bit more generously supplied and expecting even more, the criteria and also the transmission phase we are in, COVID transmission phase, has changed the protocol, which NCDC will elaborate upon. I think that's all for the health sector.
So some very challenging questions, but that's why we're here. Firstly, what are the long-term effects of COVID-19? Well, you know, COVID-19 is 6 months old, so there can't be long-term effects. We can't study things before we know what they are. So the longest history we have of anyone with COVID-19 are the patients from China that are 6 months old. Our first patient here was in late February. The foreigner, we had 1 month before we started seeing patients in mid-March. So research is ongoing. We have a study called The First Few Hundred Cases that has started, where we're looking at the clinical features, risk factors of all the people diagnosed with this disease. So research will come out, but research needs time. And that's really a fact of life. So we keep studying, and that's how we've come up with what we know already. And this knowledge will keep evolving, and we keep adapting what we know and use it to adapt the response. So really that's the answer to your first two questions, both in terms of long-term effect and also indigenous findings in Nigeria. There are several research projects going on, both by ourselves and the clinicians managing these diseases in their clinical settings on specific issues. So that's ongoing. As results come out, we'll let you know. I'm really sorry about the results not having been released. They've been released to the Federal Capital Territory, but rest assured that everyone with a positive result has been informed. So if you haven't received your results, you're negative. Please, your results will be sent to you today. But having said that, there's a bigger challenge, and what we're doing, there's an online platform that is being set up at the moment to enable the electronic transmission of results back to patients. So we've been working very hard on that. So that should launch over the next few days, hopefully by the end of the weekend, where you can go in yourself and check your result once you've been tested, and you have a code that is given to you. So we're working very hard on that, so that anyone that knows his own code can go and check your result and know what it is, so that we don't rely on several steps between federal lab and state governments in order to share those results. So that's some IT innovation that is happening that should get out soon. So we take that point. That will also help the question on turnaround time. A lot of the challenges with turnaround time is actually not the testing. It is this process of providing the results from the lab to the state, and then the state to the patient. So that's really what we're trying to disrupt using technology, using an online platform where people can check their results once it's been tested in the lab. The other thing was on the call center. You know, the quality of the call center has improved a lot, but also as the disease has progressed, we've had 26% of all our calls last week were hoax calls. 26%. So 1 in 4 of all the calls coming to the NCDC Connect Center were hoax calls. People just calling for one reason or the other, to check whether you're there, to challenge you, to ask you about Madagascar cure or something like that. So, you know, these are challenges that we have. They clog the lines, but we keep trying to manage that. And also remember that in most of the calls that come to us, our role is to do a risk assessment and then transfer you to the state government that will ultimately collect your sample. Which brings me to the next question on whether NCDC drivers are picking you up or not. NCDC has never picked up patients. This has always been a responsibility of state governments. In the FCT, the responsibility of the FCT to pick you up, take you to the treatment center that they think is appropriate. So we as a public health institute, we don't provide clinical care. That's the responsibility of the case managers at the state, and sometimes federal and FCT, federal government teaching hospitals, so, or FMCs. So that's really how the process works. We've received a lot of criticism for sometimes physically carrying people into ambulances. I can assure all Nigerians that that hasn't been NCDC, and it is definitely not our role to evacuate patients. That Plateau has run out of test kits, I'm very surprised about that. Every lab has had the kits to keep on testing, so I don't know who provided that information, but right now the National Veterinary Research Institute is one of our most active partners in testing. They're in VOM, and they're premier testing lab in Plateau State, and they're doing very well. So I'm not sure where that bit of information came. If we have more details, we can look into it. There was a question on whether it's possible to be infected through open wounds. As far as we know, it is not. It's still a respiratory virus, both in terms of transmission from one person to the other, but also receiving from others. So at the moment, the best we know is that both getting infected and infecting others all passes through the respiratory tract. Whether it's airborne or droplet is what we're looking into, but all transmission still happens through the respiratory tract. There was a question if we will print out results. At the moment, if you need printed out results, you can get it. Right? We will provide anyone that requires. Some people require printed out results for different reasons. We would provide those results. We don't do it at the moment, and even in the future, it's unlikely that we'll be sending out paper to people. But if you need it for whatever purpose that you need it, we will offer you a printout of your results. We do so already. We did a few this morning. A comment on the extraction kits that were announced by NAPTA. They have been working with some of their collaborators in developing a new extraction kit. Our role was to see if the kit works. The set of samples, the kit that they sent to us provided similar extraction results than our commercially available kits. So that was good news. But there are still many steps in producing large quantities to scale and to the quality consistently over time. So you know the difference with both reagents and medicines, any of those substances, one key thing is consistency of quality. So if you're producing a reagent, it needs to be exactly the same quality, whatever batch you've produced, whether it's medicines, vaccines. So this is a very high standard, because we need to know if we give you 500 milligrams of paracetamol or a shot of vaccine or a reagent, that it produces replicable results. So there are still a few steps towards going from a set of reactions to a production line that is efficient. It's only when they finish all of this that they can come back to us and say whether they're now ready to deliver to scale and consistently. And of course, we will all celebrate this at that point when that reagent becomes available. On the new research and whether it affects our guidelines at the moment, it doesn't change anything. It only strengthens our guidelines at the moment as they stand, saying that everything we have said already around droplet spread actually needs to be emphasized even more if airborne transmission is an option that we are considering. I think that's all the questions answered. Thank you very much for those. Thank you.
With regards to the question as to whether having COVID increases your risk of post-infection sequelae. So as Chikwe rightly said, this is still work in progress. In a way, COVID is still an early infection. But what is clearly emerging is that sequelae appears to be a major health problem post-COVID. There are patients globally that have continued to have a lot of breathlessness, fatigue, and body pains more than a month after recovering from COVID. There are also inflammatory changes that have persisted both in the heart as well as in the lungs in terms of CT scans. And possibly in terms of clues on how COVID may leave its mark on the body, we should actually look at SARS, which is the first coronavirus that was described, because it has a fairly similar sort of spectrum, the only thing being that it causes more severe lung disease. And with SARS, there have been, more than 2 years after SARS, patients that have had SARS continue to have significantly reduced lung capacity in terms of their ability to exercise, etc. So what I'm trying to say here is, yes, a lot of people survive COVID. 80% will only have mild to moderate illness. Only 20% will end up in hospital. Only a small fraction would die. But even for those that survive, they can end up with significant comorbidities. So the more reason why we should try and avoid catching COVID in the first place. Sorry? That was not the question. Anyway, I'll move on to the next question since it wasn't originally meant for me. But so when will the train services resume? So this will be determined by the Federal Ministry of Transport. Just a few days before we went into the current phase, we actually contacted the Honorable Minister of Transport and the Minister of State, specifically with regards to train services. We've asked them to put in place the necessary operational framework and guidelines similar to what the aviation sector have done to enable them to start. So the ball is back in their courts, and once they get back to us and tell us that they are ready, then we will have no issues in terms of signing them off. In terms of sexual and gender-based violence, yes, we continue to regret the occurrences of gender-based violence, some of which were linked to the prolonged lockdown we've had. For workers that are in the emergency services, of course, they are essential and they should be excluded for the period of the curfew. And as I said, any emergency as well would be excluded. But if there are specific organizations that need to have sign-offs or passes, they can contact us directly. Thank you.
But related, one is the relationship between COVID-19 and the environment, and the other one is whether or not COVID-19 is an environmental pollutant, right? The relationship, well, first of all, you can say the COVID-19 is using the environment, in this case the air, as a medium to travel to infect people, whether it's the droplet or the micro droplet, which are called aerosols, that potentially can infect somebody if he is in contact with somebody who had COVID and had cough or sneeze. So we just leave it that this is the relationship. It exists during that cough or sneeze and uses the air to infect somebody. Number two, whether it's an environmental pollutant, quite all right, yes it is. Anything in the environment, either in excess or a newly introduced contaminant that can cause problems is a pollutant. So COVID-19 is a pollutant in the environment, it's an environmental pollutant. And there's a difference between pollutant and contaminant. Pollutant is when you increase the level of already existing substance in the environment. For example, carbon dioxide. In nature, it exists. And now we have increased the amount of carbon dioxide in the atmosphere, which is part of climate change issues. So that is a pollutant. Then we have contaminant, which did not exist in nature. For example, chlorofluorocarbons that are used for refrigerant. Those are contaminant. They are new, they are not part of the environment you introduce. So, but together you can say, they are also contaminant as well as pollutant. So COVID-19 is a pollutant, air pollutant. Thank you. The possible impact of COVID-19, okay, thank you. The possible impact, the possible impact is, there are two things here. One, that it will now make us to be a lot more conscious of our environment, particularly our interaction in terms of biodiversity. Originally, this virus came from either monkeys or pangolins or some other animals. So there is what we call biodiversity, plants, animals, pathogens, people. So there is that. Now what we have to do is to make sure that we keep separate some of this biodiversity business. That's why we have the BSMA in my ministry, the biosafety agency, which keeps track of the kind of interrelationship with different kind of biotics. And that will take us to the GMO issue, genetically modified organism. You take one and try to use another to enhance. Well, you may mix something that will turn out to be bad instead of good for humans. So this will be something that will also make us to keep track of. Another thing, perhaps now that the virus has changed so many things, in the future, we'll try and make sure we know what kind of things do we do. This is a new experience, let me put it this way. It's a new experience that in the future we'll now know more about a new disease in its relationship with humans or animals. We have gotten additional experience literature that will keep us safer in the future. So this is basically the impact that will leave to really strengthen our knowledge base in terms of making sure that we are prepared and ready for any eventualities in the future. Welcome.
Before I actually get to those questions, I want to clear. I've just come back from the village. I went to see my father. And when I came back, they told me that Ministry of Education has done a policy somersault, that the Honorable Minister, Malama Adamu, has changed everything we said. I want to tell my fellow Nigerians that nothing is further from the truth. Malama Adamu is consistently in tune with what we have all said here. If you had listened to the chairman of the PTF on Monday week, he came out straight. No schools are reopened. We did not reopen any school. He was only given what we had just received, which was the timetable as published by WAEC, and advised that this period, from now till when these exams will take place sometime in August, anybody who wanted to use the schools will have to follow those kind of guidance, and that the Ministry of Education will issue those. The PTF never said here that they were reopening any school. They only provided that assurance and that guidance. After FEC on Wednesday, the Honorable Minister, Malam Adamu, advised the public that based on the information that PTF and NCDC has profiled, that the unity colleges, because those are only 104 out of 19,129, we only, as a federal government, own 104 of such centers, that he will not agree, and in fact it is not advisable, and goes further to advise that we do not open those institutions for the use of this, and that perhaps it is ultra-vires WAEC to impose those dates, and that we will be engaging WAEC to reconsider dates. However, that he is not in charge of private schools, and that he is not in charge of the schools that fall under the concurrent list and therefore devolve to subnationals who can take a decision as to what will happen to their state-owned schools and whether they can participate in WAEC or not. How anybody can read what he has done as inconsistent or in any way in any difference with what we have consistently advocated and provided on this platform is something that beats my imagination. And I ask the country to please reconsider those kind of assumptions, because they are not true. What he has said is exactly what the chairman of the PTF had done, and that's exactly what we have profiled. And that is in tune and in line with the guidelines that we released today. And I want you to go through those guidelines and see that that was exactly what he was talking about. We want to stay and bring everybody in sync. However, we do not rule the world. We do not rule people's families. We don't rule private institutions. We do not rule anybody. We can only provide guidance. And that's what we do as a ministry. Which then leads me to the two questions that have been profiled here today. One, if you listen to what the president of the Private School Owners Association said on TVC this morning, I think Chief Olubel, he has said that he wrote a letter to the vice president because of the sustainability committee, and that he had advised that federal government helps pay their teachers. Those teachers are not on IP's payroll. There's no way, there's nothing we do not know who they are. So when I got this same letter advocating something like this prior to now, I had written back saying it will do the association a lot of good to let us know who these teachers are. I don't think there will be teachers that can be helped by the federal government if they do not have teacher registration council numbers, because as of last year, we have said anybody who is going to be in any classroom in Nigeria must be a registered teacher, so that we begin to limit quackery. And that we expect them to put in operation. And since they have the BVN and they have all the details of these people, I advised on this platform as well, a couple of weeks back, that I will urge them to take advantage of the CBN window, which has already been provided by the federal government, to support small and medium scale enterprises. They didn't say industries. They said even education is an industry if we want to classify it. But all enterprise, including schools, are enterprise. And you can have salary augmentation provisions and loans, which will carry your people for the next 12 months or 1 year or 6 months or 3 months, as the case may be, as you so desire, to augment what you do not have at the moment. It is in that spirit that he may have written the office of the vice president. And if he says he has gotten a reply from the office of the vice president saying that the vice president will give him any money, I'm not privy to that letter. But I don't think that's what he's saying. He didn't say so. He is saying that he will, that this sort of arrangement that I'm asking you, I'm expatiating on, is the kind of arrangement he is planning to make with his members, so that they can then upload who their membership, who they are, what kind of salary structure they have, and what kind of augmentation and loan scheme they can get, even to support their infrastructure. And I believe that the window actually is available at the central bank, and that we are willing to do this, because we own only 68,000 public schools around Nigeria, whereas the private sector owns some 35,000 primary schools around Nigeria. And at the secondary school level, they almost, I've told you, federal government only owns 104 secondary schools, the unity schools. That's all we own in secondary school. But there are 19,159 WAEC centers around Nigeria, nearly 20,000. So really, any assistance we would like to work with them and we would like to assist. So we have not taken over their salary in the Ministry of Education. Even we are looking for our own salary, not to talk about. But I'm just saying that it is important before you bring hazard allowance and all the other allowances that are associated with takeovers. But I'm speaking, since I'm also acting on behalf of the humanitarian, I'm almost her assistant minister. The palliatives that this would seem to be would then go to a request in the office of the vice president under the sustainability, economic sustainability, if you listen to him. So he's not really looking for it as a palliative or something to be addressed to the humanitarian ministry to extract from them. It will be guided under that economic sustainability window that the federal government is talking about, for which a budget has now been signed and for which CBN has made ample provisions. So I want us to be all guided in that respect. Yes?
Just for clarification, sir, are you implying that only unity schools are exempted from writing WAEC and that all other schools can go ahead to prepare and take WAEC examination?
For clarity, Malam said the 104 schools are not available. He does not have control over the governors. It will be unconstitutional for anybody to say he can tell the governors what to do. You've heard from the chairman consistently that we try to marry what we do with the governors forum. So the governors forum, if they are advised, like we have advised them on the mathematics, I'm sure they will, because what we want and what the purpose of the PTF is to have a national response, a unified response. So they may look at all the data we also have, and it appears to me that they increasingly understand the same things we are doing, but we do not want to impose anything on them. We can't say we have told them that we must do. No, nobody's shaking his head around here. The first question, who was that? Okay, thank you very much.
Sir, quite a naughty issue, but I think we've come to a resolution about that. Let me see, the questions have been answered, but Nancy, you've spoken severally about this data. It's commerce. That is left for the service providers and the regulators to fashion out. They've already received enough of negative impact from COVID-19. So the sustainability of their business is uppermost in their minds. And how they can retain their customers will determine their response to whether they should discount data for the purposes of these virtual meetings. And I believe that if you quantify the amount of money that is expended on travels to go for meetings, paying for data is inconsequential. Paying for data is inconsequential. Because if a meeting is scheduled now in Lagos and 3 or 4 people will leave Abuja to go to Lagos, quantify the amount of money that will be expended with the exposure to risk of so many things happening. Not only COVID-19, there are risks attendant to every form of travel. And I believe for them to procure data for a virtual meeting is totally inconsequential to the amount of money that will be expended if they will have to travel to a particular location for the purposes of holding those meetings. Even if the meetings are within the city of Abuja, the amount of gasoline that will be burned to travel from different locations to go to the venue of the meeting is nothing compared to the amount of data that can be procured for the purposes of the meeting. So on the basis of cost analysis, I think it's advisable and it's encouraged for people to hold virtual meetings. This is about the week now that the Federal Executive Council has basically transacted its businesses virtually, with the exception of the few ministers that have memos that come into the council chambers so that we can maintain social distancing. Virtually, the meetings are being held virtually. The National Economic Council, the same thing. Even ECOWAS, even when we had to engage with the president of China on the Africa-China COVID-19 response, it was virtual. International meetings of the level of UN are being held virtually. That's the new norm. The world is transiting to different experiences, and it's better we begin to adopt to it. That will cost down the cost of governance. Because I can assure you that sitting as a secretary to the government, I know how much is expended on travels and meetings, on our yearly budget, which you have access to, because our budgets are uploaded on the internet of every ministry, website of every ministry. You can see the budget, you can see the cost of travel. If we can substantially even cut down on the cost of travel and unnecessary meetings, we can channel those amounts of money and deploy them to building our infrastructure, making sure that even our IT infrastructure is upgraded to a level that the world is transiting to. We can't be left behind. So I would encourage, like I said in my statement, that as much as possible, meetings that exceed 4 people in any of the government institutions should be conducted virtually. And there should be a cut or a discontinuance of unnecessary travels for meetings now. There are so many reasons for that. And because of the prevalence of community transmission now, we have to be extremely careful so that we do not have government institutions shutting down. You've had the experiences of several government houses where from one test, 32 people turning out to be positive. How do you run a government in one location, in one institution, 32 people coming down with infection? You expose the government and the people to a higher degree of risk in terms of governance. So I believe that that is a caution, and that is a suggestion that should be taken and considered seriously. Dr. Sani has answered the question with regards to when will the trains start to operate. We have left that within the province of the Minister of Transportation to decide. Like we have done with aviation. It was aviation that said, this is the time we are ready. And we think we have in place the necessary protocol to allow us open. We kept going to and fro. The Ministry of Transportation, I believe, are working on that because they helped in also constructing the model when we were taking a decision as to opening up on interstate travels. They had a series of meetings with the road transport owners, with the motor park administrations in the different constituencies, and with commissioners of transportation or transport in the various states before they came up with the protocol that we have put in place with regards to interstate travel. So I believe when they are ready they will come up with a protocol that would be useful. Also, a protocol that will help them to maintain a balance in the economics of running a railway. Our railway system in Nigeria is highly subsidized, so they have to really balance and see which way to proceed. And there was a question about impact of COVID-19 on the environment. And I think one of the biggest impact is the reduction in urban pollution particularly, and emission. That is it. As a matter of fact, once vehicular movement was ceased for a period of time, even the Google map will show you that the level of emission over the city of Abuja was indicative of the fact that there was a high degree of reduction of urban pollution and emission into the atmosphere. And I think that has helped tremendously. And the fewer vehicles we have emitting unnecessary smoke in the environment, the better for us, so that we can preserve this planet of ours. Over the weekend, like I said, Thursday and Friday, we had a very rigorous engagement with members of the National Assembly, with also the development partners, with the UN organizations, to interrogate what we have done so far. And I can tell you that it was a brainstorming session and quite productive. And we saw clearly what we've been able to achieve in terms of our response. And we also defined a roadmap to improve on our performances. Before then, there were findings that came out of a perception survey on the PTF program that gave us a clear picture of what has been done. Those pictures indicated what we had done very well, what we could have done better, and what is our next step. And I believe that looking at the remaining few months ahead, before we get to the prescribed date of the 6 months that we've been given, it will help us really navigate the processes as it stands today. Because at the end of, and the discussions were very, very frank. They were very frank, they were very bold, where we needed to be criticized, where we needed to be commended, came out. And for me, it was, and my colleagues, I believe it was a very enriching exercise. Because we saw where we were in terms of, Dr. Sani has spoken in the laboratory on that, in terms of our achievements. We saw where we were in terms of the challenges. We even saw the missed opportunities. And going forward, how do we redeem these missed opportunities if they would ever present themselves? And how do we deal with the challenges? And how do we improve and leverage on the successes that we have recorded? Eventually, a very comprehensive document for posterity will be produced so that coming after us, if there would ever be another pandemic, those that will be charged with the operations or the response of the pandemic will not be navigating in the dark, trying to find their way, whatever nature of pandemic that would occur again. But they would have a document that will help them in terms of their processing, in terms of their planning, in terms of the kind of things that they need to put in place so that our health systems are not overwhelmed. But I think for me, one of the things that stood out, and I would want to end with that, is this issue about risk communication, our perception of risk. And honestly, that is what has complicated the issues of COVID-19 worldwide, where even leaders, their perception of the risk of COVID-19 has created missteps in terms of how to deal with it. And I leave that with you because you have a responsibility as those that have the responsibility of driving the narrative out there, that one of the things that we should not relent in doing is talking to our people about taking personal, individual responsibility for what happens to them. Like the executive director of WHO rightly said, he said, we can be advised by government. We can be advised by science. But in the end, it comes down to personal motivation and personal choice. But in the end, it comes down to individuals and it comes down to communities. If it does not feel safe, it is not safe for you. That is a choice you have to make. And that is the choice I'm appealing to Nigerians to make. If it does not feel safe for you to take any action that will put you in harm's way, please, it is not safe for you. I had spoken severally about reckless confidence. I have spoken severally about Nigerians who were dreadful and scared of COVID-19 in March, now beginning to romance COVID-19 by their conduct and their attitude and their actions. My passionate appeal this evening is that the time for responsibility has come. It is almost eluding us. And the only way we can interrupt this transmission is by taking personal responsibility, by what we do. Believe you me, there's hardly anything government can do than to tell you there is danger ahead. No government restriction can keep you in your house. No government restriction can force you to wear a mask. It's a choice. Even if there's a penalty for it, you pay the fine and decide to throw the mask and come back again. So I believe that as a people, as a community, as a nation, we need to take that responsibility, because that is the only way we can interrupt this transmission. And probably by the time we peak, because we have not peaked yet, our figures are not growing exponentially as expected. But you can see also the rate of fatality. Last week was the highest. We recorded 70 in 1 week. So it means that the figures of the infections now will begin to show by the negative impact in terms of fatalities in the next 2-3 weeks. And that's why we need caution. And that's why we were bold to say that if you are over 60, please, if you have no reason going out, like some of us that are over 60, we have a reason, because right now I have been asked to lead with my colleagues in this response. I can't abdicate that responsibility. But if you have retired, you are home, please stay at home. Stay at home. It's better. It's safer. That's my appeal. And I believe that those of you that are here with us, you have a responsibility, as much as we do, to appeal to our countrymen and women, that taking personal responsibility is the name of the game now. Whatever government does, it is advisory. You either heed the advice or the consequences can be there. Thank you and good evening.
Thank you very much, Chairman PTF on COVID-19.